What are the best and worst birth control options?
The worst best option is your natural pull out this thing.
Correct.
The
That we just spoke
best
about.
is the protection.
The protection. Alright. As simple and clear. And is hormone replacement therapy for menopause bad for women? Or is there a therapy?
There are two types of menopause, the artificial created and the natural one. The artificial created, whenever the woman goes into the removal of her sexual organs like uterus, ovaries, then she'll be an premature menopause will be there. Then she needs the HRT. Whenever she crosses her menopausal age, like 50, 51 years, I don't think she needs natural care.
Alright. Would you like to give some suggestions to the women who are going through the menopause? Because like we understand, it is not a 5-day or a 10-day process. It goes on for a long time. So
yes, it's called a climactic phase. Before she reaches the menopause, she has to suffer few irregularities from the age 40, 45 to 50, 51, where she attains the menopause. At that point of time, there will be a variation of hormones. That's a fluctuation of hormones where the moods and the body pattern also is going to get changed, and she herself does not understand what's going through her. Then, of course, she has to approach the gynecologist and take the assistance.
So the menopause in every woman is not the same. So it varies from woman to woman. So it's always good to consult a gynecologist and then take necessary actions based on that. Going on to the next question. What should a woman do if she forgets her birth control pills? And would you suggest birth control pills in the first place?
There are two types of birth control pills. The month-to-month taking birth control pills are emergency pills. Emergency pill will not help them much. This birth control pill for one day, if they skip today, tomorrow, the same time they can use both the tablets, this tablet and for the day's tablet. To the maximum of 2 days, if they skip, and they can take. After that, no, they cannot take the birth control pills. They can continue the birth control pills with extra protection. See, 1 or 2 days, if they skip, fine. If they skip 3rd day, 4th day, then they have to take the extra protection along with the birth control. They should not stop abruptly. Abruptly, they should not.
Moving on to the next question. Does a man go through a menopause?
It's not a menopause. It's a sexual hormone, it's a testosterone, you can say. Testosterone pause. Pause means they become on halt. So the age limit for the menopause, the testosterone levels coming down in a men also is there. So it's a bit later than the woman. So it's 50 plus. Woman is 40.
40 plus. And do men also go through some hormonal changes? And
yes.
So who do they have to consult? If they're going through some psychological
issues also, they have to go to the physician, whomever they can fight into, or a counselor, or a gynecologist, anybody will.
How often should a woman get a pelvic exam and a pap test?
Every year.
Every year?
Every year if she is active sexually.
And what would you say about the increase in cervical cancer that causing a lot of deaths in Indian women in the past few years?
Every 5 to 7 minutes, a death due to the cervical cancer.
That's one of the highest in
India. Gynecological cancer, which is killing the women throughout the world. But the same thing, we do advise a screening test of pap smear every year. The person who is being exposed to the sexual activity, irrespective of their age.
Does piercing genitals increase the risk of infection? Because there are people who undergo such piercing, getting a foreign particle into piercing them onto the body. But piercing them onto the genitals, would that increase infection?
They will get infected because the area is such, almost all the bacteria, all the things will be there existing on the surface. Piercing with any of the objectives, they will be prone for the infections other than the sexual activity also.
Correct. So this infection would be at a higher risk when they are actually getting this piercing done and not after that.
Yes, they can damage their natural barriers also.
So would you say that women should stop getting their genitals pierced in the first place, or they should have that option to do it, but they should take
It
necessary
depends on
precautions.
the mentality of the person, the pattern, then the psychological pattern. So before to that, if they really want to do that, get a counseling done where they can get it.
All right. Does a person diagnosed with HPV once in the past still have it? Is there still a risk for cervical cancer?
Yes. HPV virus is a slowly progressing thing. It takes years together to surface on the detection. So the reason why the changes will be there in the nucleus of that particular cell. So we will be studying the nuclear cell for the HPV virus progressing. Then only we will get detected. So the reason why we will ask the woman, especially every year, to go through the pap smear test, especially target of the HPV.
So women should actually actively go every year and get a cervical test.
Screening test.
Pap screen.